1. A nurse working in a busy emergency department receives a trauma patient who is unconscious and requires immediate life-saving surgery. The patient has no identification, no family present, and no advance directive available in the chart. The surgeon asks the nurse to prepare the patient for emergency surgery without consent. The nurse is concerned about legal implications of proceeding without explicit informed consent, but also understands the urgency of the situation. What is the most appropriate action by the nurse? A. Refuse to assist until written consent is obtained. B. Proceed with preparation under implied consent. C. Delay treatment until a court order is obtained. D. Contact hospital legal counsel before proceeding. Answer. B. Proceed with preparation under implied consent. Rationale. In emergency situations where a patient is unable to give consent and delay would threaten life or health, implied consent is legally assumed. The nurse should act in the patient's best interest. 2. A nurse overhears a colleague discussing a patient's HIV status loudly in the hospital cafeteria where visitors are present. The nurse understands the importance of confidentiality and HIPAA regulations. What is the most appropriate initial action? A. Report the colleague immediately to the nurse manager. B. Ignore the situation since it is not their patient. C. Confront the colleague privately about confidentiality. D. Document the incident in the patient's chart. Answer. C. Confront the colleague privately about confidentiality. Rationale. The nurse should first address the issue directly and professionally to stop the breach. Protecting patient confidentiality is a legal and ethical duty. 3. A competent adult refuses a blood transfusion due to religious beliefs, despite the nurse explaining that refusal may result in death. The patient is fully oriented and understands the consequences. What should the nurse do? A. Administer the transfusion anyway to save the patient. B. Notify the provider and document the refusal. C. Seek consent from family members. D. Obtain a court order to override the refusal. Answer. B. Notify the provider and document the refusal. Rationale. Competent adults have the right to refuse treatment. Autonomy. The nurse must respect the decision and ensure proper documentation. 4. A nurse accidentally administers the wrong medication dose, but the patient shows no immediate adverse effects. The nurse fears disciplinary action and considers not reporting the error. What is the nurse's ethical obligation? A. Monitor the patient and report only if symptoms occur. B. Document the correct dose instead. C. Report the error according to policy. D. Inform only a trusted colleague. Answer. C. Report the error according to policy. Rationale. Honesty and accountability are essential. Reporting ensures patient safety and aligns with legal and ethical standards. 5. A nurse is asked to float to a unit where they have no experience. The nurse feels unprepared to provide safe care. What is the most appropriate action? A. Refuse the assignment immediately. B. Accept the assignment without question. C. Accept but request orientation and assistance. D. Leave the shift early. Answer. C. Accept but request orientation and assistance. The nurse should not abandon patients, but must advocate for safe practice by requesting support. 6. A patient confides in a nurse about plans to harm another person after discharge. The nurse is aware of the patient's mental status, including recent threats, and is concerned about potential harm to others. What is the nurse's priority action according to ethical and legal standards? A. Maintain confidentiality because the patient shared the information in confidence. B. Notify appropriate authorities immediately, including the provider and possibly law enforcement. C. Ignore the threat since it will be addressed in outpatient follow-up. D. Document the threat in the chart but take no other action. Answer. B. Notify appropriate authorities immediately, including the provider and possibly law enforcement. Rationale. The nurse has a duty to warn and protect potential victims. Threats of harm to others override patient confidentiality. Immediate reporting is both an ethical and legal requirement to prevent injury. 7. A nurse accidentally administers the wrong medication dose, but the patient shows no immediate adverse effects. The nurse feels anxious about reporting the error and considers leaving it undocumented. What is the nurse's ethical and legal obligation? A. Monitor the patient and report only if symptoms occur. B. Document the correct dose instead to avoid consequences. C. Report the medication error immediately according to facility policy. D. Inform only a trusted colleague but not the chart. Answer. C. Report the medication error immediately according to facility policy. Rationale. Even if no harm occurs, medication errors must be reported and documented accurately. This ensures patient safety, transparency, and legal protection for both patient and nurse. Failing to report can result in legal liability and professional discipline. 8. A nurse is asked to float to a unit where they have no prior experience. The nurse feels unprepared to safely care for patients in this specialized unit. What is the most appropriate action? A. Refuse the assignment immediately without discussion. B. Accept the assignment without question to avoid conflict. C. Accept the assignment but request orientation, supervision, and support. D. Leave the shift early to avoid providing care. Answer. C. Accept the assignment but request orientation, supervision, and support. Rationale. Nurses must provide safe care within their competency. Requesting assistance or orientation balances patient safety and legal protection. Refusing outright without discussion may be inappropriate, and accepting without support could lead to negligence or malpractice. 5. A nurse restrains a patient without a provider's order because the patient is agitated and poses a potential risk to self or others. What legal issue is most likely to arise? A. Negligence. B. False imprisonment. C. Malpractice. D. Defamation. Answer. B. False imprisonment. Rationale. Applying restraints without a provider's order or proper legal justification is considered false imprisonment, which is both a legal and ethical violation. Restraints can only be applied according to policy, law, and patient safety protocols. 10. A nurse administers a procedure to a patient who explicitly refuses, believing it will be harmful. The patient is fully alert and competent. Which legal term best describes the nurse's action? A. Assault. B. Battery. C. Negligence. D. Libel. Answer. B. Battery. Rationale. Battery is the intentional, non-consensual touching or treatment of a patient. Performing a procedure without consent, even with good intentions, violates the patient's legal rights and can lead to criminal and civil liability. 11. A nurse discovers that a colleague has been documenting vitals and medications for patients that were never actually administered. The colleague claims it was just to keep up with workflow. What is the nurse's best course of action? A. Confront the colleague and allow them to correct it themselves. B. Report the incident to the nurse manager immediately. C. Ignore it because no harm has occurred yet. D. Ask patients if they noticed any discrepancies. Answer. B. Report the incident to the nurse manager immediately. Rationale. Documenting care that was not given is fraudulent and illegal. The nurse has an ethical and legal duty to report to protect patients and the facility. 12. A terminally ill patient requests assistance with dying. The nurse is unsure about legal and ethical responsibilities. What should the nurse do first? A. Assist immediately to relieve suffering. B. Discuss the request with the provider and follow institutional policy. C. Refuse and tell the patient they must endure suffering. D. Document the request but take no further action. Answer: B. Discuss the request with the provider and follow institutional policy. Rationale: assisted dying laws vary by jurisdiction. The nurse must follow legal and institutional guidelines, ensuring patient autonomy is respected without violating the law. 13. A patient in a psychiatric unit becomes verbally abusive, threatening other patients, but is not physically aggressive yet. The nurse considers applying restraints. What is the most appropriate legal and ethical action? A. Apply restraints immediately to prevent escalation. B. Attempt de-escalation first and document interventions. C. Ask other patients to intervene. D. Ignore the threats unless physical aggression occurs. Answer: B. Attempt de-escalation first and document interventions. Rationale: restraints should only be used as a last resort. Legal and ethical standards require less restrictive interventions first. Documentation is essential for legal protection. 14. A nurse receives a request from a patient's family to withhold the diagnosis from the patient due to cultural beliefs. The patient is alert, competent, and asks directly about the diagnosis. What is the correct action? A. Withhold the information per family request. B. Provide full disclosure to the patient. C. Ask the provider to lie to the patient. D. Avoid answering and redirect the conversation. Answer: B. Provide full disclosure to the patient. Rationale: competent patients have the right to autonomy and informed consent. Ethical practice requires honesty and disclosure, even when family requests otherwise. 15. A nurse notes that a patient has developed a pressure ulcer due to improper positioning during a lengthy procedure. The nurse fears liability. Which is the best course of action? A. Document the finding honestly and report to the provider. B. Attempt to cover it up to avoid blame. C. Blame the assistant who helped during the procedure. D. Ignore it since it's minor. Answer: A. Document the finding honestly and report to the provider. Rationale: transparency and accurate documentation protect patients and staff legally. Failing to report could be considered negligence. 16. During a code situation, a nurse notices that a colleague administers an expired medication. The patient survives, but the nurse knows this could be legally significant. What is the ethical action? A. Ignore it, since no harm occurred. B. Report the incident according to hospital policy. C. Ask the colleague to lie if questioned. D. Delete the medication record. Answer: B. Report the incident according to hospital policy. Rationale: patient safety is paramount. Administering expired medications is a violation of standards and must be reported to prevent recurrence. 17. A nurse is caring for a minor whose parents refuse vaccination due to personal beliefs. The child's school requires vaccines. The nurse is unsure about legal obligations. What is correct? A. Administer vaccines anyway to comply with school rules. B. Educate the parents on legal and health implications. C. Ignore the school requirements. D. Obtain consent from the school instead of parents. Answer: B. Educate the parents on legal and health implications. Rationale: minors typically require parental consent for treatment. The nurse should educate and advocate without violating laws. 19. A patient who is alert and competent refuses a life-saving surgery. The family insists the surgery must be done to save the patient's life. What is the nurse's ethical responsibility? A. Respect the patient's decision and support informed refusal. B. Override the patient and follow the family wishes. C. Ask the physician to force the surgery. D. Convince the patient to comply with family. Answer: A. Respect the patient's decision and support informed refusal. Rationale: patient autonomy is a fundamental ethical principle. Competent adults have the right to refuse treatment even if it may result in death. 19. A nurse is asked to witness a signature on an advance directive, but notices that the patient seems confused. What is the correct action? A. Witness the signature anyway. B. Refuse to witness and notify the provider. C. Ask the family to witness instead. D. Sign on behalf of the patient. Answer: B. Refuse to witness and notify the provider. Rationale: witnessing requires that the patient is competent and fully understands the document. Signing otherwise can have serious legal consequences. 20. A nurse is documenting in a patient's chart but is unsure about some entries made by a previous shift. What is the best approach? A. Delete the previous entries to avoid confusion. B. Make clarifying entries and note any discrepancies. C. Leave it as is without comment. D. Ask a colleague to alter the entries. Rationale: documentation must be accurate, factual, and transparent. Clarifying without altering prior entries maintains legal integrity. 21. A nurse witnesses a colleague verbally berating a patient with dementia in front of other patients. The patient appears frightened and withdrawn. What is the nurse's best ethical action? A. Confront the colleague privately and document the behavior. B. Ignore it to avoid workplace conflict. C. Tell the patient to ignore the colleague. D. Only report if physical harm occurs. Answer: A. Confront the colleague privately and document the behavior. Rationale: verbal abuse constitutes ethical and legal misconduct. The nurse must advocate for the vulnerable patient and document the incident to protect patient rights. 22. A patient asks a nurse not to tell their spouse about a terminal diagnosis. The spouse is also the patient's healthcare proxy. What should the nurse do? A. Respect the patient's confidentiality. B. Inform the spouse immediately. C. Ask the patient to sign a consent form. D. Refuse care if patient refuses disclosure. Answer: A. Respect the patient's confidentiality. Rationale: ethical principle of confidentiality overrides the spouse's proxy rights unless patient is incompetent or law requires disclosure. 23. A nurse administers medication via the wrong route, but realizes immediately. The patient shows no adverse reaction. What is the correct legal and ethical action? A. Monitor the patient and take no further action. B. Report and document the error immediately. C. Alter the record to show the correct route. D. Ask the patient not to mention it. Answer: B. Report and document the error immediately. Rationale: errors must be reported and documented honestly to maintain patient safety and comply with legal standards. 24. A patient with a do not resuscitate order experiences cardiac arrest. A new nurse, unfamiliar with the order, begins resuscitation. What should the nurse do? A. Continue resuscitation until provider arrives. B. Stop resuscitation immediately and verify the DNR. C. Delegate to another nurse. D. Call family before stopping. Answer: B. Stop resuscitation immediately and verify the DNR. Rationale: following the legal DNR order is required. Delaying or ignoring it may constitute battery or negligence. 25. A nurse is caring for a patient in isolation for a highly infectious disease. The nurse considers skipping PPE to save time. What are the legal and ethical implications? A. It is acceptable if the nurse is experienced. B. It is a violation of patient safety and legal infection control policies. C. It is the patient's responsibility to enforce precautions. D. It is only a minor ethical concern. Answer: B. It is a violation of patient safety and legal infection control policies. Failure to follow infection control can harm patients and staff and has legal and professional consequences. 26. A nurse is asked to falsify patient data for insurance purposes. What is the correct response? A. Comply quietly to avoid conflict. B. Refuse and report per legal and ethical standards. C. Alter only minor details. D. Ask a colleague to do it instead. Answer: B. Refuse and report per legal and ethical standards. Rationale: falsifying records is fraud and can result in criminal and civil liability. Nurses must uphold integrity. 27. A nurse observes a student performing a procedure incorrectly. The student asks the nurse not to report it. What is the best action? A. Ignore it to support the student. B. Correct the student immediately and report as appropriate. C. Document only if the patient is harmed. D. Wait until the shift ends. Answer: B. Correct the student immediately and report as appropriate. Rationale: the nurse has an ethical duty to protect patient safety and to supervise learners appropriately. 30. A patient refuses medication due to side effects, but the provider insists it must be given. What is the nurse's role? A. Administer the medication anyway. B. Educate and advocate for the patient's decision. C. Delegate the task to someone else. D. Document refusal but do nothing. Answer: B. Educate and advocate for the patient's decision. Rationale: nurses must respect autonomy while ensuring informed decisions. Forced administration can be legally considered assault. 29. A nurse is caring for a minor who requests confidential reproductive health services. Parents are unaware. What is the nurse's legal responsibility? A. Always notify parents. B. Provide care as permitted by law and maintain confidentiality. C. Refuse treatment to avoid legal risk. D. Only provide counseling without treatment. Answer: B. Provide care as permitted by law and maintain confidentiality. Rationale: many jurisdictions allow minors limited rights to confidential reproductive care. Nurses must follow local laws and policies. 30. A nurse receives a verbal order that contradicts the patient's written advance directive. What is the correct action? A. Follow the verbal order immediately. B. Verify the order with the provider and review the advance directive. C. Ignore the verbal order. D. Ask family to decide. Answer: B. Verify the order with the provider and review the advance directive. Rationale: legal documents such as advance directives take precedence. The nurse must clarify to avoid legal and ethical violations. 31. A nurse is caring for a patient who reports past abuse. The patient does not want authorities involved. What should the nurse do? A. Respect confidentiality entirely. B. Assess if mandatory reporting laws require notification. C. Notify authorities regardless of patient wishes. D. Ignore the disclosure. Answer: B. Assess if mandatory reporting laws require notification. Rationale: certain abuse cases are mandated to report by law. Nurses must know state regulations while maintaining sensitivity. 32. A nurse is asked to witness a consent form but notices the patient appears confused. What is the correct ethical action? A. Witness the form anyway. B. Refuse to witness and notify the provider. C. Have the family witness instead. D. Sign on behalf of the patient. Answer: B. Refuse to witness and notify the provider. Rationale: witnessing requires competence. Signing otherwise could have serious legal consequences. 33. A nurse is asked to participate in experimental treatment without IRB approval. What is the appropriate action? A. Participate because the provider requested. B. Refuse until proper ethical and legal approvals are confirmed. C. Ignore the requirement. D. Document but participate anyway. Answer: B. refuse until proper ethical and legal approvals are confirmed. Rationale: participation in research requires ethical oversight to protect patients from harm and legal liability. 34. A patient requests that certain information be removed from their chart. What is the nurse's legal obligation? A. Remove the information. B. Refuse removal and document the request. C. Alter the chart discreetly. D. Hide the information from colleagues. Answer: B. Refuse removal and document the request. Rationale: health records are legal documents. Altering or removing information is illegal. Requests must be documented. 35. A nurse administers pain medication without checking the patient's allergy history due to time pressure. The patient has a reaction. What is the most serious legal implication? A. Negligence. B. Battery. C. Assault. D. Fraud. Answer: A. Negligence. Rationale: failing to perform due diligence constitutes negligence and can result in legal consequences if harm occurs. 36. A nurse witnesses a colleague taking controlled substances from the unit. What is the nurse's first action? A. Confront the colleague privately. B. Report to the supervisor immediately. C. Ignore since patient care is not directly affected. D. Wait for another nurse to notice. Answer: B. Report to the supervisor immediately. Rationale: diversion of controlled substances is illegal and dangerous. Immediate reporting protects patients and staff. 37. A patient's family wants all information withheld due to cultural beliefs. The patient asks directly about their prognosis. What is the nurse's ethical action? A. Withhold information. B. Provide accurate information directly to the patient. C. Ask the family to lie to the patient. D. Delay conversation until provider is present. Answer: B. Provide accurate information directly to the patient. Rationale: competent patients have the right to truthful disclosure regardless of family preferences. 38. A nurse is asked to perform a task outside their scope of practice. The nurse feels unsure. What is the correct legal action? A. Perform the task because no one else is available. B. Refuse and notify the supervisor. C. Ask a patient to perform the task. D. Delegate to a non-licensed colleague. Answer: B. Refuse and notify the supervisor. Rationale: performing outside scope can lead to malpractice liability. Nurses must advocate for safe, legal practice. 39. A nurse is documenting medication administration and realizes a dose was given to the wrong patient, but no harm occurred. What is correct? A. Ignore since no harm occurred. B. Report and document the incident accurately. C. Alter the record to hide the error. D. Ask the patient not to tell anyone. Answer: B. Report and document the incident accurately. Rationale: honest documentation is a legal and ethical requirement regardless of patient outcome. 40. A nurse is caring for a patient who refuses to eat due to religious fasting. The patient is at risk for malnutrition. What is the nurse's role? A. Force the patient to eat. B. Respect the patient's choice and educate on risks. C. Ignore the patient's fasting. D. Contact family to enforce feeding. Answer: B. Respect the patient's choice and educate on risks. Rationale: respecting autonomy is essential, but nurses must also educate and monitor for harm. 41. A patient's health record contains outdated information. A provider instructs the nurse to update it without verifying accuracy. What is the ethical action? A. Update as instructed. B. Verify accuracy before updating and document the process. C. Ignore the update. D. Alter information to match provider expectations. Answer: B. Verify accuracy before updating and document the process. Rationale: accurate records are legal documents. Falsification can have serious legal consequences. 42. A nurse suspects elder abuse in a patient, but the patient denies it. What is the nurse's legal obligation? A. Ignore if the patient denies abuse. B. Report suspicion to appropriate authorities per law. C. Ask family for clarification. D. Wait until more evidence is gathered. Answer: B. Report suspicion to appropriate authorities per law. Rationale: mandatory reporting laws require reporting suspected abuse even without patient confirmation. 43. A patient requests that a procedure be performed by a nurse of the same gender only. The nurse is the opposite gender. What is the correct response? A. Refuse and leave the patient unattended. B. Accommodate the request by arranging another qualified nurse. C. Ignore the request. D. Force the procedure for efficiency. Answer: B. Accommodate the request by arranging another qualified nurse. Rationale: respecting cultural and personal preferences is ethical and can prevent legal complaints. 44. A nurse witnesses another nurse verbally threatening a patient. What is the most appropriate action? A. Document only. B. Report immediately to the supervisor. C. Confront the patient about exaggeration. D. Wait for physical evidence. Answer: B. Report immediately to the supervisor. Rationale: verbal threats violate ethical standards and can constitute assault. Immediate reporting protects the patient. 45. A nurse is asked to help in a mass casualty situation but feels unprepared for trauma care. What is the safest action? A. Refuse to help. B. Assist with incompetency and request supervision. C. Perform advanced procedures anyway. D. Leave the facility. Answer: B. Assist with incompetency and request supervision. Rationale: nurses must work within scope, but still support emergency response safely.
46. A nurse is asked to provide care to a patient with infectious disease, but the nurse refuses due to fear of personal exposure. What is the legal, ethical consideration? A. Refusal is always acceptable. B. Nurses have an ethical and legal duty to provide care if trained and equipped. C. Ask another nurse to cover without informing supervisor. D. Leave the hospital. Answer: B. Nurses have an ethical and legal duty to provide care if trained and equipped. Rationale: duty to care is a professional obligation. Refusal without valid reason may have legal and ethical repercussions. 47. A patient reports financial exploitation by a caregiver but asks that it not be reported. What is the nurse's legal responsibility? A. Respect the request entirely. B. Report according to mandatory elder abuse laws. C. Advise the patient to report it themselves. D. Ignore until more proof emerges. Answer: B. Report according to mandatory elder abuse laws. Rationale: certain cases of elder financial abuse are mandated to report, regardless of patient consent. 48. A nurse is caring for a patient under a court order for psychiatric admission, but the patient resists all care. What is the nurse's correct action? A. Force treatment without documentation. B. Follow the court order and hospital policy documenting interventions. C. Ignore patient refusal. D. Release patient. Answer. B. Follow the court order and hospital policy documenting interventions. Rationale. Court orders authorize care, but documentation and adherence to policy are required for legal protection. 49. A nurse suspects a patient is being abused at home, but the patient refuses help. What is the correct course of action? A. Respect refusal and do nothing. B. Offer resources and report if law mandates. C. Confront the abuser directly. D. Document in a private notebook only. Answer. B. Offer resources and report if law mandates. Rationale. Patient autonomy is respected, but mandatory reporting laws may require notification. Nurses must balance ethics and legal duties. 50. A nurse notices a pattern of medication errors by a colleague that could harm patients. The nurse feels conflicted about reporting due to fear of workplace tension. What is the nurse's ethical responsibility? A. Ignore to maintain team harmony. B. Confront colleague and report per policy. C. Only document privately. D. Wait until a serious error occurs. Answer. B. Confront colleague and report per policy. Rationale. Patient safety is the priority. Ethical duty requires reporting unsafe practices. You've just gone through some of the most commonly failed ethical and legal Nclex questions. This is where many candidates lose easy points. Mastering these concepts can be the difference between passing and repeating the exam. Keep practicing, stay sharp, and always think like a safe, accountable nurse. Subscribe to the channel for more high-yield Nclex questions, deep clinical breakdowns, and exam-winning strategies.